does in white patients or white people. And that's not because our biology is different or our genes are different. There are certain risk factors that can affect your brain health moving forward. And that's what I would really like to talk about today. So, Alzheimer's disease is a disease of aging. So, you may notice what they call senior moments as you get older. It may take you longer to remember someone's name or to pull a word up. Usually, if you give yourself time and you're not stressed out about it, you can come up with that name. That is normal. So as we get older, processing of information just takes a little bit longer. And I like to tell my patients, it's like you have a computer that's stuffed with information and your brain is trying to go through all those files to pull out the information. So as we get older, it takes a little bit longer to pull that information out, but you should be able to do it. When you start to have problems not pulling out the right information, that's when we can get concerned. But what's important to know is that if you want your brain to age well, you need to get started on brain health when you're a teenager or even when you're in young adulthood. Because just like any organ in our body, you have to have good health over a lifetime so that as you age, that organ can stay healthy. And so when does good brain health start? Well, you should have good brain health for your entire life. I always say aging well starts with good prenatal care. So one of the things we would have to think about is whether we would want our kids to play a contact sport like football, where they may be getting concussions when they're in the Pee Wee League or even in high school. But the main thing that I like to talk about are some of the risk factors that we can control. And we can reduce our risk. We may not be able to eliminate it completely. And right now, Alzheimer's disease does not have a cure. I'm doing a number of clinical trials out of our Department of Geriatrics and our Center of Excellence for Alzheimer's Disease to test novel drugs, but they are still in the research phase because there is no drug right now that can cure Alzheimer's disease. But there are things that we should start thinking about. And here are some of the things, and you know I'm a doctor, so you're gonna hear me say do not smoke. Everybody thinks of smoking as causing lung cancer, but it also changes the blood vessels, the lining of the blood vessels, which can change the way blood flows to your brain. And people who smoke are more likely to get dementia. You should be very careful about the alcohol you drink. Contrary to public information, alcohol is not really healthy for us. A lot of the studies that suggested that wine is good for us was sponsored by the wine industry. So obviously they have a bias there. But we know that alcohol is actually toxic to nerve cells and it's not good for a brain to age well. Anything that you do that keeps your heart healthy will keep your brain healthy, because the same blood vessels that go to your heart go to the brain, they go to your kidneys. And so if you have high blood pressure, for example, over time, that can change the lining of the blood vessels, the way that your heart can pump, and the way that blood can circulate in your brain. And we know that high blood pressure that is not treated increases your risk of getting Alzheimer's disease and other dementias. We also know that diabetes is a big risk factor. And just like hypertension, which is very predominant in African Americans, so is diabetes. And a lot of diabetes is based on our diets, especially if you have type 2, which means that your body still makes insulin, but your body is less sensitive to the insulin that it makes. And we know that diet and exercise are two big factors in developing diabetes. And we know that people who have diabetes over time have a very high rate of developing Alzheimer's disease or another dementia. So if you have hypertension and you have diabetes, then you are really increasing your risk of having dementia or Alzheimer's disease. We also know that stress can be a factor. And this is actually a source of a lot of research right now. The fact that we as African Americans have some daily stresses that are just based on discrimination and racism, it becomes like background noise. We forget about it, but our bodies don't. And we know that when we're stressed, our body creates these hormones that were really developed to help us physically fight. But when we're not doing a physical fight, when a lot of the discrimination that we experience is psychological, those hormones are still going through your body. And they can also increase inflammation. We're starting to understand that chronic inflammation is responsible for a lot of diseases that we're experiencing. Hypertension, diabetes, certain cancers, and they're also looking at the role that chronic inflammation can play on the brain. And stress can lead to chronic inflammation. So can a certain diet, a diet that's very high in sugars and processed food can lead to a chronic inflammatory state that causes wear and tear on your brain as well as other organs. So we're looking at stress, we're looking at a diet. You may have heard of the Mediterranean diet, which is based on eating food that is low in bad fats like cholesterol or the fat that might come from fried foods and bacon, and more on fresh vegetables, whole grains, light on the sugar, and light on the foods that you just pop in the microwave and eat. Fast foods, anything that's quick and that was already prepared for you often has a lot of the nutrition taken out, and in its place is a lot of salt, which causes hypertension, and a lot of sugar that increases your risk of diabetes. The other thing that people can do, which is probably better than any prescription I can write, is to figure out a way to exercise every day. And people say, oh, I don't have time to exercise. And I say, well, then I hope you have time to get sick. Because we know that people who exercise every day, you don't have to plan to run a marathon. If you could set aside 30 minutes a day to walk, that reduces your blood pressure. It improves the way your body handles sugar, so it can reduce your risk of diabetes, or if you have diabetes, it can help it be under better control. It reduces the stress hormones that I talked about that are bad for the brain. It also can build up your muscles, and when your muscles are healthy, your body can handle insulin and sugar better, and it keeps your heart pumping. The other thing is that when you exercise, your body makes these little chemicals that help nerve fibers grow and stay healthy. And that's another thing that helps with the brain. It helps your brain repair and keep itself healthy. So these are all things within our power to help reduce our risk. Because I say, once you have Alzheimer's disease, we just help you through it. We help you manage the symptoms. But at that point, we can't fix it. We can't make it go away.
Okay. You're done?
Yeah, I can talk some more if there's questions or.
Oh, there's lots of questions. Well, I have lots of questions.
Okay.
Let me start with some that I heard you say. I was very fascinated around this idea of body of trauma. I'm going to call it body trauma as a result of racial trauma that impacts the body and daily microaggressions, and the fact that there's more research. Are we learning more about this, or is this something that we've always known and we haven't talked much about it?
I think that number one, we call them micro, and I don't know why we call them micro, because I don't
still
think
aggression, right?
Yeah, I think that's like the way we help certain people feel better, like calling it unconscious bias and microaggressions. It lets people think that they're not that bad, but they are bad. We internalize it because we usually have to figure out a way to keep moving forward. And that takes a toll on our body. It is really a new area of research, because in general, research that's done in this country is based on diseases and processes that focus on primarily white people and primarily men. If you look at most research studies that are done in this country historically, they've had very few African Americans in them, very few women, and everything is really based on the people who are valued. So I can give you examples of, say, cystic fibrosis, which is a horrible genetic lung disease that affects primarily Caucasians, compared to sickle cell disease that everyone thinks is just for African Americans, but it really strikes a broader group of people from the Mediterranean into India, but it has been labeled an African American or a Black disease. The amount of research that's done for cystic fibrosis is proportionally much larger than what's been done for sickle cell, even though sickle cell affects a large number of people. I'm not trying to say that we should not research cystic fibrosis. I'm just showing you a comparison. Another example is I went to an international meeting a couple of years ago where all the big drug companies who are looking at new ways of treating Alzheimer's disease present their data. And this was international data, and there were no Black people in any of those studies. There was a small group of Asians that were Japanese because they did one of the trials in Japan. Other than that, those studies were essentially 99.9% done on white people, whereas we know Alzheimer's disease is 2 times more common in Blacks. So here again is a big studies, billions of dollars all across the globe, and it had no Black people in it. That led to me working with a team from Mount Sinai to apply for a grant, which we were successful in getting, to look at ways of adding diversity to aging research. And I'm in the process of getting that started here in Syracuse so that we can encourage more African Americans to participate in aging research so that we can start to understand if there's differences, if there's similarities, are there any different ways we might respond to drugs? Right now, we do not know.
Right. Thank you for that, Doc. We have 3 questions in the queue. One is, what do you mean when you use the term other dementia?
So dementias can also be due to multiple strokes, and we call that vascular dementia. Parkinson's disease can give you dementia. There's another dementia called frontotemporal dementia, which is different because we see behavioral problems more than memory problems, and it tends to occur in younger people. So that's another kind of dementia. Lewy body dementia, which is another type of dementia that has a lot of hallucinations and behavior problems, as well as memory problems, as well as stiffness. So there's a whole group of dementias that we evaluate in our office setting, but Alzheimer's disease is the #1 that we see.
You know, and I keep thinking when you talked about diet and processed food and how in some of our communities, poor diet and processed food is prevalent. It's no wonder as you look at that as a risk factor, why we're seeing what we see. Next question is, what specific steps can a person take to maintain brain health as you age? I know my mother-in-law used to do puzzles.
So puzzles are just one piece of our brain. Our brains are so complicated. So some people hate puzzles, and I say
not puzzles. I meant the word searches.
Crosswords, word search, Sudoku.
Yeah.
Those don't really have any impact. If you like doing them, keep doing it. It's really building up your brain bank while you're younger. So you should be reading, you should be listening to music, you should be having a lot of experiences, doing something new that helps to create new nerve tracks in the brain. You should do some of the things that I talked about. Make sure you wear your seatbelt. Don't climb up on ladders and get a concussion. Develop an exercise program so it doesn't feel like a chore. It should be something that you just do, just like you brush your teeth and comb your hair every day. It's just something that you do to maintain your health. And then, of course, it's diet. And just like you said, George, if you look, I can talk to my patients about how it's important to eat fresh fish, which is very, very expensive, or to get chicken. And if they can even get it in their neighborhood without
Right,
going
right.
somewhere. But you can go to McDonald's and get 3 Whoppers or whatever. That's Burger King. You can
But
tell
we know
how
the
often I eat there, but you can
yeah, we
get
get it.
3 with the big fries and a soda for $3.99.
Right.
You
And
know,
also in the neighborhood stores, does your practice accept Medicare or VA referrals?
we take all referrals. So you can have your doctor refer us. You can refer adult children, sometimes call up about their parents. We accept Medicare and all insurances.
You know, and so at what point does someone transition to you? Like, I'm a senior, but I don't think I'm ready yet.
No, you're not ready yet, George.
Okay, all right, thank you. All right.
So
Listen, so I just want to get that clear. So you're really talking about not me. All right, cool.
no, you're
Um,
not ready. So
all
most
right,
of our patients are in their 80s or 90s.
all right.
Most
Thank-
people don't need us when they're 65. 65 was a very arbitrary number that was set.
Right, right. All right. Here's another question. I often misplace my keys, and when I find them, I often can't remember putting them there. Should I be concerned, or is that back to maybe I was doing too many things at one time?
So it depends. Yeah, I would need a little bit more information. But what we are often doing is we are doing 3 or 4 things at once. So
Mm-hmm.
you may be putting your keys away, but you're also thinking about what you're going to make for dinner, that you have to answer an email. Your kids may be talking to you, and the TV is on. So we have to pay attention to one thing at a time. Our brains were made to do one thing at a time. And whenever you try to do more than one, you may think you're doing well, but the little neurons in your brain, the nerves in your brain have to shuffle around and they take attention away from all those tasks. So you end up not being very efficient.
All right, so let's bring this in, and then we'll get one more question, and then we'll go to Dr. Mbuke. Listen, let's talk about devices, right? The digital devices, because we're here and we're there and we're doing this so we're always on those devices. Talk to me about the impact of devices on our brain health, because we are often doing this. We're always doing something with the device.
So I've been reading articles about how addictive these devices are. They were created in a way that they make you never want to put them down.
Mm-hmm.
And when you are on your device, you are not paying attention to the people around you. One of the most important things for brain health is to be socially connected. And that social connection does not work well through a device.
Mm.
The
As
best
we're finding out during the pandemic, right? Because
the best social connection is in person with people in your household. And I look out of my window, I see mothers walking down the street with their kids, and the mothers are on their cell phone, and the kids could be hit by a car.
Right.
So we have to really look at our addiction to our devices. And when you're on those devices, you're getting little bits of information. You're probably not focusing long term on anything. So we train our brain to flip back and forth.
Mm-hmm.
And that sustained attention that's needed helps you remember things. And when you flip back and forth, you're not retaining a lot of information. So therefore, you won't remember where you put your keys. You may not remember an errand or something until maybe you're doing something else. We have to give our brains a chance to relax. We're on overload. We have information overload. The amount of information we can get from the news in 24 hours is more than our parents used to get in their lifetime.
We used to get it like at 6, 5, 6, and 11, or whatever the times were, not all day and all
Now we
night.
have our phone ringing, there's breaking news. Our brains are bombarded with a lot of information. Most of it is stuff we can't do anything about. So it may increase your stress level, which isn't good for your brain. And then it's too much to digest. So then you can't find your car keys, you can't find your glasses. Your spouse may be talking to you and it's not getting absorbed because you're not paying attention.
And I get on my kids all the time. They're at dinner table. This is what they're doing. I was like, can you talk to me? Last question is, does the lack of diversity in the medical research play into hesitancy by Black and brown people to participate because of the lack of diversity?
Well, I'm sure it does, because a lot of times the studies are designed by people who have no idea about the lifestyle or the day-to-day issues of African-American brown communities. So for example, I have a study going where you have to have a study buddy. That means you have to have somebody who comes to you for every visit. And those visits are during the day. So if you have a study buddy who has a job where you have to punch in with a punch card, you can't just take off for 3 or 4 hours.
Right, right.
You know, and so then who are we going to really get in this study? We're going to get white collar people who can take time off, who have vacation time or personal time, and they can afford to take 3 or 4 hours and bring their mother in for a study.
All right. Thank you, Dr. Brangman. We'll have more with Dr. Brangman if we have time a little bit later on. So one of the things that Dr. Brangman talked about was stress and the impact that it has on brain health. To help us deal with our mental health today is Dr. Sipho Mbuke. He's a senior counselor at the Student Counseling Services and assistant professor in the Department of Psychiatry and Behavioral Sciences at SUNY Upstate Medical University. He's the department's diversity officer as well. He did his undergraduate and postgraduate work in South Africa at the University of the Western Cape. He holds a master's degree in mental health and a PhD in clinical psychology. Both his research and clinical interests focused on oppressed and or marginalized social groups. He's presented in national and international conferences on violence, race and racism, race in higher education, and Black masculinity. So let's hear the view of mental health from Dr. Mbuke.
Wow, thank you for having me. And it's Dr. Brangman said a lot, which really overlaps with what I'm going to say. So the beginning point is that you cannot talk about mental health in Black population or in Black communities without talking about racism. You just cannot. And because one, racism touches every part of their life. It's pervasive, it's persistent. That is, the time you fight to get rid of it, it finds a way to get back. Two, it carries an enormous amount of violence. It is violence. I know people are beginning to change that now, but if you look back since Second World War to the 60s, racism was considered a form of violence. It still is, but I think we're slowly getting back to that. What makes it effective is what it does, it denies opportunities and access to everything you can say. College, mental health, education, jobs, it denies those opportunities. It is very adaptive. Nothing is as good as changing itself as racism. What it looks like today, it changes and find a way of expressing itself tomorrow. And then it's really nicely woven into every day in our lives. Like Dr. Brangman indicated, that we have stresses. So what does it do is that I like to give people this typical example that you walk out in your house and go to a store. You know what you wanted to do, and you know exactly what that you wanted to get. And you did not go into that store with any intention to steal. You've never carried that intention in the first place. So you go into the store, you know what you want, and you walk into a store and somebody looked at you. At the first glance, they decided that you are going to steal something, and they follow you throughout the store. You walked in, everybody thinks that shopping is a wonderful thing, but if you're white,
Mm-hmm.
if you're black, it carries its own issues. So this is just an everyday thing that everybody does. There's somebody who follows you throughout the store. You are relaxed, all of a sudden there's a little bit of tension. There's a little bit kind of frustration. If you get that every day when you are black. There's no moment you can say, you can say, I did not experience that. You are over scrutinized every day. And then you are overlooked when it comes to achievement and successes every day. If you do achieve, if you do succeed, if you do things, you are underappreciated. If you go out, it happens so many times that when you go out looking for just a normal service or anything that comes with respect, it does not extend to you. You are a human being and you experience these things every day and they take a toll on you.
Mm-hmm.
Now, that was before COVID-19. COVID-19 comes along where you cannot do all these activities you used to do sometimes that help you cope with this stuff. You have to be your space and the people that you used to interact with, that is restricted.
Mm-hmm.
Now, there's something that they used to say in South Africa that when you are in a racist society and you're black, your space and both your physical and your psychological space is always restricted.
Mm.
And so COVID comes in where all of these things that already at the social and at the psychological level that already exist. And what happens then, because we have to share spaces and our spaces are very limited. You would have more people living in smaller spaces. That creates more social tension. There's more chances of interpersonal violence because people feel, displaced and cramped. All of these things contribute to stress and to just distress. Now, that's just COVID-19, and then there is George Floyd.
Mm-hmm.
Now, I'm using George Floyd because it just happened in this past June, but there are so many of them. But here's the deal. The day George Floyd dies changes every day. There is a day that's on a birth certificate. But there is a day that every Black person discovers this. When that Black person discovered that, for them, that day, it just happened.
Mm-hmm.
So even if this happened like 6 weeks ago, when you hear it, it seems as though it just happened today. And it triggers all of these sources of distress, all of like one, I give people a simple example that, for example, at Upstate, if there is a shooting of an armed Black man that took place 5 months ago and it caught the national media attention, all the Black men at Upstate get frantic calls from their family members.
Mm.
Hey, are you okay? Be careful. All of this happened a month or two ago. It caught the national media attention now, and we all know about it. Those students get those frantic calls that be careful, when you meet with the police, all of that. So that happened to them, even though it happened 5 months ago. To them, that death happened today. And if it's not men, you have women who have brothers and sisters. they are frantically calling their brothers and sisters. I mean, their brothers say, "Hey, be careful," as though this is just happening right now, completely disrupting whatever they were set to do at that moment. I call it the shock of an old thing. It's old, but it still shocks you, and you know that this is going to happen. Unfortunately, we all know that this year is not going to end without that kind of an incident. And that takes a toll on you. And when all of those things happen, when the world is just closing on you, and then the world is physically threatening you, like you're about to be killed, and you can walk to a store, or you can see a cop or a police officer, it's not a friendly encounter. You really, really clammed up. One of the first lessons I learned when I came here as a South African, I was pulled over, and when they pulled me over, I got out of the car to go to the cop. This is like within 6 months of being in the US. He screamed at me to stay in the car. And I went to we were meeting as graduate students, and I told them, everybody, especially the Black African American men, like, what is wrong with you? You can never do that again. But in South Africa, if I get pulled over, I can go to a cop and say, hey, it means nothing. Because most of the time, that cop looks like me. That cop is my sister. So it's completely different. And those are the things that I say, like, I've never lived in a society that's not racist in my whole life. I've lived in South Africa and I've lived in the US. But I can tell you, nothing prepares a person. Racism in America is completely unique. It is heavy. It is very nice. It smiles every day, yet cuts you. It pats you on the back and then stick a knife at you at the very same time. And all of those things lead to moments of cognitive dissonance that you don't know, oh my God, what do I get tense, or do all of these things? These are everyday encounters. One of the, like when growing up in South Africa, I used to say there are two forms of oppressors, and we would classify them. There's an Afrikaner, a Dutch, or there's a British. The Dutch will come, or the Afrikaner or the Boer, they'll take a pound out of your flesh. They'll just yank it out and they walk away and they don't care. The British descendants would come in, they take the same thing, that same pound, and yank it out of your flesh. But what they do is they blow that wound afterwards, as though they don't, it's like, oh, we don't want you to get hurt, so we're going to blow it, and they walk away. So who's the better oppressor? Which one? Who's more violent? Who's not violent? At the end of the day, the fundamental point is that you had somebody who came in and they brutalize you physically. The one who blow and add to your wound, it's not about you, it's about them feeling good about themselves, so as they can walk away and saying they are very good people. That's the danger of the American racism. That it is the very good people who come in and take a pound out of your flesh and blow an air and smile and say, you see, I'm very good. I just don't take a pound out of his flesh and walk away. I blow an air so as though that is just a temporary relief of that pain. The person has to deal with that constant trauma on the other hand. And it is well researched now that racism leads to depression, both in African American and in African American men and African American women. If you're depressed, you're likely to have, and when you are depressed, you're likely to struggle with low self-esteem, which is self-doubt, difficulty concentrating, isolating yourself, lack of motivation. And I'm mentioning all of these things as things that help you function on everyday life. There are other symptoms, but the ones that I mentioned are the ones that help you get up every day and face people and function. You start relying more on substances, very irritable, which affect your relationships. You're constantly worried, and just really the pleasure in existence is slowly moving away. And then you start thinking about the meaning of your existence, whether it's worth it or not. It is everywhere, and especially this whole year, COVID, and then you bring George Floyd, which has made it even difficult for people to usually gather and grieve together. But what makes it, here are the things we can do. One of the most difficult thing among Black folks here and in South Africa is seeking psychological help. Now, there's a whole reason for that. We can talk about how psychologists, the things they have done, and I'm a South African, the architect of apartheid was a psychologist. We can talk about that. But also, if a society places so much weight on you, wouldn't it be great to have a place where you can deposit that weight? I've always been amazed at how quickly and easily white folks would come to therapy and they would seek therapy. Even students, and how difficult, and the shame and the stigma that comes with the Black community. And when I really mean in both here and in South Africa. It tends to be very similar in ways it shows itself up. But you've seen, I think in the last 2 years, it's been very interesting to see how open people begin to talk about it. Athletes, celebrities, they really begin to say, I'm in therapy, I cannot do this without therapy. But here's the other part that Dr. Bregman mentioned, and I just want to go through it, that all of these things, they contribute to hypertension, obesity, diabetes, our eating habits, and we tend to have risky life habits because of the intersection between race and racism in our lives. That the most dangerous part of racism is when we begin to treat ourselves as the way the oppressors treat ourselves. That's the hardest part, even to address in therapy. So yes, we have, if you exercise, the huge part, exercise goes a long way. Try to find therapists. We're working hard in our department to try and bring in people who look like you, and also those who don't look like you, to sometimes understand that we need to change the way we practice. I had a supervisor who came in one time and said he was not necessarily a great therapist because he struggles dealing with Black or diverse people, and then he had seen a Black man, but he says then, but in any case, Black men don't stay in therapy. They don't. Even though he had described an encounter that would make it difficult for that person to come back. He concludes by saying, anyway, according to the literature and the evidence, they don't stay in therapy. And then I ask him, who wrote those textbooks? Who does that research, who says they don't stay in therapy? Well, I'm not so the people who write those textbooks are the people who look like you, who don't know how to work with them. I've done this work. They stay for years with me. Those who come in. And sometimes it can be very hard to get them in, but once they get in, they stay for years. So there are ways sometimes when they come in where you're like, I have all these forms to fill, for you to complete. And the person is like, look, I need to go back to work. I don't have resources to come here. So I need to use this hour in a way that benefits me. So we also, as psychologists, as psychiatrists in our department, really have to learn how to work with these communities that need us most and can teach us how to be good at what we're doing. I know there are things we're doing in the department to try to put ourselves out there, and we are trying to do outreach. And I can tell you, I and some people in the department working tirelessly to bring psychiatrists who just, who will be able to work and are interested to work with this community. And I hope that we make progress in getting to that point. But there are social organizations that can help. We need to rely on them, revive them, but relying on them solely is never good enough. I tell people when I tell students, do you meditate? They'll be like, well, I read the Bible and I'm like, no, it's two different things. And I am not saying this because I want to challenge your faith or anything. Meditation has a different role, and I would like you to learn it. In your first year, it's going to help you in your second year when you're doing your STEP exam, and in your third year. But I want you to learn it right now and not feel and think that it is a contravening of your faith or you cannot do it. So there are many things that will be that exist and that we're slowly getting into them now. And there is a research that came out in the Mellon Foundation, especially in the UK, that has started to look at meditation and how it tends to exclude Black communities. Mm-hmm. So we are really finding ways now to really encourage our communities to start really to look into that. Even for children, it will really help with conduct issues. But also, we also need to stop. The other challenge is educating people and be aware of the tendency to criminalize Black existence.
Dr. Mbuke, lots of questions for you. And one question that I have that we can't even talk about now because we don't have the time, the idea that living under apartheid South Africa, you're implying that it's worse in America. So that right there, I know we can't do that right now, but just that notion that apartheid South Africa, are you suggesting that? Well, I have to ask now that I brought it up. Are you suggesting that? What are you saying about that before I get to these questions? Because I just want to get that understood.
I don't want to get in trouble because people, when you say that, they think you're saying one oppression is worse than the other.
All right. So,
but I'm gonna say this. Late last year, there was a resignation letter from a dean of the College of Architects at CUNY College in New York. Mm-hmm. If you read the letter from that woman, it's incredible.
All right. I don't want to, yeah.
She tells you, she lived in the UK, she lived in South Africa. She tells you she was never prepared to deal with the racism in America. This is a woman who've lived in South Africa, who've lived in the UK. Still, 9 months was enough for her to stay in the US.
All right,
I remember that letter. I was amazed by that letter.
Well, we got to find that letter then. All right, lots of questions for you, Doc. You talked about, and I'm going to start with this because you talked about how that internalized pain from also then makes us turn on each other. And that leads us to the question about what do we do about Black on Black violence?
I think,
If you believe that that exists.
well, yes.
There you go. There you go.
it's
See?
part of it, yeah. I'm going to try to address it, but before I do, I'm going to say there's no violence that exists interpersonally that is not linked to the structure of violence. That if you are one of the things, like if you are perceived as violent
Mm-hmm.
and treated with violence, you believe the way to address things is violence.
That's right. Mm-hmm. Mm-hmm.
And one of the things the nice thing we used to see, like there's a thing that image they would say for a guy who goes to work and is treated badly by his boss, and then comes home, treats his wife badly, and then his wife treats the kids badly, and then the kid starts kicking the dog or the pet. It just shows you the way how violence is carried from one level to another. And I really like what Dr. Brinkman said about microaggression. And usually when I address people in the younger one, I said, I guess I'm really old school. It's violence. It's not microaggression. It's violence. It always was, and it always will be. What happens in our communities is that our people have learned that our lives are not important. So we relate to ourselves the way the system relates to us. And it takes an enormous work for that to be different. Now let's go, let's just talk about higher education. And if there are, like, even in upstate, it's been a very interesting thing now that we are really trying to get students who are coming from historical Black universities. And you watch how we engage them even in interviews and all that, they really carry themselves differently than the people who come from predominantly white university. When you have seen people who look like you in powerful position running things, it's not an anomaly when you come in. It's not an anomaly for them to be running things. You are not shocked. But you get very shocked when you don't see them at all. It's the same thing as violence. If I teach you all the time that the way you can only understand and interact with me is for me to whip you, which goes back to slavery.
Well, you're stepping on some toes now.
So how is it that you will not engage in that thing? If you went through South African, education during apartheid, the whipping that we all got were from Black teachers. There were no white teachers. They didn't have to be there. They didn't have to be there to teach them, you need to whip them to get in line at all. They had done the work already. So part of this Black on Black violence, I engage it, but also I feel like sometimes it's a displacing of colonialism and white violence. We can address it, but what is in between those two people that is symbolic that we don't see is what they've been told about what their lives mean, and that they can only engage and understand each other if they are violent.
All right.
And they also like to talk about Black on Black crime to deflect police crime on Black people, which is state mediated crime against Black people. And that's a whole different issue. And people will have crime on their next door neighbor, and people tend to live with people who look like them. So we never talk about white on white crime, and that's the majority of crime that white people experience. But we talk about Black on Black crime as though it is a special pathology. And we say, okay, then how can you be doing that to each other and then want to talk about the police? But I think that the police, who are state mediated, and the whole policing system started as a way to control slaves from running away has a whole different level of implications than black on black crime. So when you hear black on black crime, to me, that triggers a whole bunch of
Yes.
other issues
I,
that is probably a whole nother show.
and so noted, so noted. All right, here's a very long question. Stay with me because it's very long. Here we go. New research from around the world suggests that mental illnesses are so common that almost everyone will develop at least one diagnosable mental disorder at some point in their life. The research suggests that most of these people will never receive treatment, and their relationships, job performance, life satisfaction will likely suffer. Is that true from your experience, and what does it mean for individuals and families, especially the Black community and those who can't afford a therapist? And we should know that there are some free resources in the community, but let you answer that.
I'm gonna step a little bit out of the American deception of individualism. We are always in relationships. We always, and we are already in relationship. I sit here and stand here as a brother, as a son, as a father, as a significant other to someone. All of us are always are. And as long as we in that circle, we will always experience loss and grief. That's condition of existence. So in one way or the other, we will experience loss. And that is always a condition for depression, for example. Now, I just mentioned that we are in violent societies.
Right.
All of these things contribute. From the moment you are born, I say to people, it is safer and better for a Black child to be carried, or for any child for that matter, to be carried by a Caucasian woman with a GED than a Black woman with a PhD, MD, or JD. It is safer because that Caucasian mother is not going to experience the same amount of daily stress than these people I just mentioned with the highest degrees in their field.
So is everyone likely to have some form of undiagnosed mental disorder? Will everyone have some form? Or is that a myth? Or is that reality?
Yes, yes, it happens in one form, in some stage in your life, and most of them they are really easily treated. And what is most dangerous in our community is that all of these things go unattended for a long time. And then they move from one generation to another. And when that happens, that's when they take root. It's the same with alcoholism. You see how one alcoholism affects the next generation. So every mental health does that.
Okay. Dr. Brangman, is there such thing as alcohol in moderation?
Well,
I'm trying to see if I can have some wine at some point.
I guess that becomes a personal decision.
Right.
There was a recent release, I think, by the American Medical Association saying that there is no safe amount of alcohol.
Okay.
That it is a toxin and it is a risk for multiple cancers.
Are you telling people to stop drinking?
No, I can't do that because we are in a very alcohol-based culture. If you listen, everything is based on drinking, a big social event. But I just want people to understand, there's that myth that red wine is good for you. That is not true.
Right. They say antioxidants and all that stuff.
No, you can get antioxidants from a lot of foods that are not a toxin. Alcohol is a toxin, and there is such a thing as alcohol-based dementia that we take care of people who drink. So there is no safety level, but it's a very hard thing to fight in our culture because drinking is such a predominant issue in our culture. And a lot of the research that was done was supported by the wine and alcohol companies. There's
a couple of questions. I'm trying to fold them all into one around whether Black folk are not comfortable talking to the stranger, or whether Blacks are hesitant to seek out therapy because the white therapist can't fully understand our experience, and Black therapists may be hard to find in some communities. And what's the other one? Do you think that everyone will have mental health issues, albeit different coping support mechanisms and or tolerances? So I kind of folded 3 in 1.
What I think it's just general. I mean, everybody, and also it's part of culture. If you grew up in a culture that does not, part of therapy and part of psychology carries its own. I say to people, it's really a white middle class thing.
Mm-hmm.
Now, therapy is not supposed to be that way, but it has been constructed in a way that addresses, that works with and for those people.
Mm-hmm.
And so when you come in, you are in a situation that is very foreign. When I was going to training, I would remind my one of my supervisors that the patient is not the only one who's foreign to this. I'm foreign to it too.
Mm-hmm. Mm-hmm.
But yet it's something I really, really wanted to do. And that I thought could have a serious contribution. I think that we really have to learn how to work with communities. We have to, especially in therapy, because it's really based on a significant part of it is interpersonal interactions.
Yeah. So can you just tell us that it's okay, because we still have this stigma in our community? So
yes, it is. I mean,
lift that. It's okay to go see help, yo.
It is really, it's really. I encourage people, please. We want you to come. We want to work with you. And I am telling you that if, like, I have worked with medical students, I tell them, like, look, if you work with me now, you're going to sail through medical school. And some of them will be like, no, and they'll come in, and then 2 years later, they comes like, everything you told me happened. Can we rescue what's left?
Okay.
So the other thing, I'm sorry. The other thing I was going to say, there is a shortage of Black healthcare professionals in every single specialty.
Yes.
So
period, said and done.
Yeah, it doesn't matter. You name the specialty. Most of the time, if we even are 1 percentage point, I would be surprised.
All right, we do have one last question, and then we have to go, and that we just need 1 or 2 more minutes of your time, doctors. This question is around ups and downs, and how the difference between ups and downs and a mental health condition. Isn't the human condition to naturally have ups and downs in our emotional health over a lifetime? Is there a danger in turning normal ups and downs of life into a disease or malaise?
There is no normal up and downs constituted by racism. It's not normal. We can try to think. One of the most challenging thing within Black communities, both in South Africa and in the US, is this commitment to being strong and unbreakable. That's not human. If one area of you does that, there are other areas that break and fall apart.
Yeah.
So it is just that there is if you find a society where people are not, they do not have to go to people can go to a store and not be harassed and they come back, then maybe we can have that debate. But until then, the normal ups and downs do not exist in a racist society.
Oh, you just said it in the story. All right. They want the community, wherever that letter is from the Cooney professor, we need it. You need to get it somehow, find it, if you got time to find it, drop it in the chat so we can tell people where it is. We need to see that we've got something coming up this week that we want to tell you about.
She was the dean of the School of Architecture at CUNY,
Yes.
highly recruited. That whole thing about diversity, They
Okay.
wanted some diversity, and then as soon as she got there, they began to systematically rip her apart.
All right, well, look for this. So Dean of School of Architecture is Cooney, that's City
Yes.
University of New York. Okay,
And
I
you
think
would
we have some
not
slides.
not find an architect who has published, who has written novel like she did.
Yeah, she was.
And-
Let's find it.
And one
Excellent,
part of that
excellent.
letter was the brutality that Black women experienced, that she had no idea that existed.
all of my colleagues passed it around because it wasn't unique to architecture. We could have filled in the
Yes.
blank to all of our
Yes.
specialties.
Wow. All right, I think thank you. First of all, thank you. You guys are awesome. We really appreciate you. It's so informative. I think we have a slide to show about, we have something coming up this week that we wanted to tell you about. And I'm waiting for my team here to get that slide ready. But in the meantime, as we're getting that slide ready for you, let me just thank our doctors once again, Dr. Sipo Mbuke, and also Dr. Sharon Brangman. And remember to do our post-event survey. Your opinions are of great help to us. Our next and final town hall will be March 22nd, and the topic will be cancer awareness. And our 3 presenters again will be from the SUNY Upstate Medical University. Listen, let me just talk to my team here. Here we go. All right, so we've got the survey there. There's a survey. Make sure you'll get that in your email. Please fill that out. We really do appreciate that. And let's go back to that other slide there. Yes, we're calling all high school students. We have a virtual career education seminar that is this Wednesday at 4 o'clock. All high school students joining. Okay, so they took that away from me. But yes, here it is. Calling all high school students. We're asking you to scan the QR code right there to register and a chance to win a free iPad. It's the MedTech Virtual Career Education Seminar. We're asking you to register now. There are only 40 spots available. That's brought to you by 100 Black Men in cooperation with Hill Rom. Again, it's and slide that up a little bit, please, so we can see the QR code. It's the MedTech Virtual Career Industry. A little bit more. There we go. And if you got your phone, you can put that up to the computer right now and get that QR code. MedTech Virtual Career Education Seminar this Wednesday at 4 o'clock for the youth in your community. Take your phone and take a picture of that QR code, and you can get registered right away. Once again, our panelists, weren't they awesome? We thank them so much. Join us once again, March 22nd, for our virtual, for our next town hall meeting. And that topic will be cancer awareness with 3 presenters, once again from SUNY Upstate Medical University. We thank you for joining us. Wear a mask, stay well, and socially distance. Our panel was amazing. You guys are so awesome. And we're lucky to have you both in this community. We really are. We have 2 powerhouse gems, and we thank them for the work that they're doing. And with that, on behalf of the 100 Black Men of Syracuse, we thank you.
Thank you.
Okay. Great work. I could talk to you about the South African thing all day and all night. But you know what I wanted to say about that? I wanted to say that, and then you look at how much of that pain, the art that was created. I'm not saying that that's necessary, but like I look at what South African art, like the protest songs and the music and all of that, I look at what was created, even in the midst of all of that, right?
Yeah, I mean, yes, there's a
Imagine
book,
what would be created if there wasn't that.
How about that?
yes,
So,
Okay.
you know, you
Yes.
have
Yeah.
2 hands tied behind your back,
Yeah.
but you can still do it. So yes, it's